Hello, social media. This is nurse practitioner Katina Kennedy back with some more health tips here. Today I'm going to talk really briefly about diabetes, type 2 diabetes. Type 2 diabetes is adult onset, meaning it occurs later in life and not in childhood. Type 1 diabetes usually occur in childhood. So type 2 diabetes, although it can happen to any culture, any race, however, we do see an increased prevalence in African Americans and Indian Americans. Why is this, you may ask? Well, it's our lifestyles, the foods that we eat. The foods that we eat can cause obesity. When obesity occurs, that increases insulin resistance and causes a higher levels of the blood sugars in the blood. Okay, so that's why we see the increased incidence of diabetes type 2 in African Americans and Indian Americans. How can we prevent it? Okay, well, first let's talk about some of the signs. If you have increased thirst, increased hunger, they call it polyuria, polydipsia, increased hunger, increased thirst. If you're diaphoretic a lot, if you have fruity smelling breath, fruity, that you can smell like the fruity breath odor of the breath. Also, if you just notice that you just don't feel right, if you're going to the frequent urination, increased thirst, increased hunger, sometimes numbness and tingling to the fingers and the toes. So those are just some signs and symptoms that may be of diabetes type 2. So if you exhibit those signs, make sure you go and get yourself checked, because one thing about diabetes, if you don't control it, it damages the kidneys, it damages the eyes, it damages the heart, it damages your nerves, and that's why you get the tingling and the numbness to the extremities. It also damages the eyes. So it's so important to identify diabetes type 2 very early on, and then you want to treat it. You want to do something about it, because again, if you don't control it, that's how people end up on dialysis. That's where the kidneys, the machine has to act as the kidneys. The kidneys filter our blood. So when the kidneys are damaged, it can no longer do that. So a machine has to do it for you. So those are just some complications of diabetes. How to prevent it? You hear it all the time, ladies and gentlemen. You have to eat healthy. You have to eat on a regular schedule. A lot of my, because you don't have to be obese to get type 2 diabetes. A lot of my thinner patients who acquire type 2 diabetes is because they don't eat on a regular. They skip their meals. They'll maybe eat dinner or a late lunch, and that's it. Guess what, ladies and gentlemen? Your blood sugar is not regulated that way. You go into what they call rebound hyperglycemia, which is an influx of the sugar in the blood. You have to keep that glycemic control throughout the day. So you are damaging yourself. You are causing yourself to go into type 2 diabetes by not eating regularly. You have to get your breakfast, lunch, and dinner at least. You all know the rule for the metabolism. You have to eat your breakfast, snack, lunch, snack, and dinner, and snack for my diabetics. But for everyone actually, but for if you have diabetes, you have to get that bedtime snack. That's why you probably notice when you wake up in the morning, your blood sugars are high because you only ate your last dinner, like around 6 or 7 o'clock at night. Yes. So you have to get that bedtime snack. So again, exercise, eating healthy, eating regularly. It's all about keeping the fat, okay, the adipose tissue decreased in the body, because insulin, the tissue, the fat cells, they cause insulin resistance. Okay, so it's hard. The insulin comes from the pancreas. All right, your pancreas is in your right upper quadrant of your abdomen. So the insulin is secreted from the pancreas. So when that insulin cannot get through your tissue, because it's so much adipose tissue, so much fat tissue, then it's hard for it to get through to the blood. Hence, that's why you have the higher levels of blood sugar in your blood. Hence, hyperglycemia or type 2 diabetes. So again, take charge of your health. Type 2 diabetes is a very, very complex disease, and I can go on and on about it. But the main thing I want you to take from this is recognizing the sign: increased thirst, increased hunger, frequent urination, fruity breath. All right, if you have those, go get yourselves checked out. Very important. Those are some signs. Ways to prevent it: exercise, eat healthy, eat regularly. That's all for today, social media. This is Nurse Practitioner Katina Kennedy with your help tip regarding type 2 diabetes. Let's stop this increased prevalence that occurs in African American community and the Indian American community. Take charge of your health, social media. See you soon.